thank you. I know, now I took you from taking notes. I hold it about 14 inches away, and I ask you to just put your hand gently over one eye, and can you look at this card, and can you tell me the lowest numbers that you can read there from left to right?
372646.
Perfect. And now can you do the other eye? And then show me the same.
372646.
Okay, now what was wrong with what I just did?
Should have had her do the second one backwards. So
Second one backwards, yeah. Yeah, hold it in one spot, but second one backwards, because she could have memorized that one.
I was wondering about
Exactly, so have them go backwards, okay? On your cards, you'll see there's numbers. If they can read the numbers, great. If they can't, you can look at the E, or some of them are U's, but the E, which way it's going, and then there's X's and O's. And then if you look all the way across, you see what the vision was. And you're good, 20/20.
How many do you have to get right to count that line?
You should count that line. You need to get them all right.
All right. So one wrong.
Yep. Yeah, one wrong gets you into the line before. Okay? And then our pupil gauge is on there also, and we just kind of hold it up like this and see which question.
Oh, yeah. So do we go through the numbers and the E's and the X's and O's?
Not at all.
Only if they
Pick
can't
one
get
of
the
them.
numbers.
Yeah, pick
And
one
like,
of them.
could you switch back and forth, like do the numbers in one eye and the X's
Sure
and
you
O's
can.
in the other?
Absolutely. Absolutely. Yep. Yeah, just describe pretty well with, what you're going to ask them to do. Just kind of, I'm going to have you read the numbers from left to right, and then when you go to the other side now, see the X's and O's. Can you read the X and O across and tell me what you see? And you need to determine is it right to left or left to right. Okay. So that's our vision card, and we want to do vision before we start shining lights in people's eyes, because you do your fundoscopic exam first, and they're seeing white dots. So we want to do our vision card first, and then we're going to do our the visual fields by confrontation, a minimum of 4 each side. And this is the one where I ask you to just gently cover one eye, and I cover that same side as they're covering. And then I'm going to ask you to just look at my fingers. Can you see that? Tell me when you can no longer see them.
no longer second.
Good. Can you see them?
Yes.
Tell me when you can no longer see them.
No longer second.
Good. That was 4 sides. We did upper outer, inner outer, and the 2 lower. Or we could do this one if we want to. And come straight across, straight across. Tell me when you no longer see it.
You have to wiggle them?
I like to wiggle them a little, just to keep their attention on them. One of the things that, like, if the patient had macular degeneration, they might be fine peripherally. That's why you say, tell me when you can no longer see them, so that if you come across in central vision, and they go, oh, I can't see them. Oh, yeah, now I can see them again. So that would be, or they get real blurry in the central vision, something like that. So that's why I kind of wiggle them. Yeah. I don't know. You don't have to. And you know what? Actually, what works really well is a tongue depressor with like a red piece of tape on it. You tape the end of it. Your reflex hammer, like this, works very well. So you can do it this way and come down. Can you see it? Can you see it? Keep it looking. When can you no longer see it?
But is it all right with using 2 fingers?
Absolutely fine. Yep. Yeah, either way. Just watch getting your arms in front of them. You kind of want to just keep your fingers there. That's why when you saw me go like this way, I'm trying to keep my elbow out. I have this hand over my eye. If I switch, then the patient switches because they're watching me. So it's kind of weird. So just make sure your elbows and stuff and arms are going in front of them, just the fingers. And stay on that record elbow, stay right on that plane.
So if they can still see you like down here,
It's
you have to
perfect.
like, okay.
No, and I could tell when I was doing this, yeah, no, I can't see it anymore. And you could probably go really thin. We really want to, make sure that they're really thin, about a 60-degree visual field. Okay?
So, because this is in comparison to your visual field,
Yeah,
is this
problem.
kind of like
It's
a
just
very,
a very gross
gross
measurement.
size. Okay.
Exactly. Exactly.
But they do have, like you were saying before, you have machines that, like, if
Oh,
there
yeah.
are machines that can do it, so it's not always just a random gross
Yeah,
test.
absolutely. And remember, this is kind of us in a family practice or something like that, or in an ER, doing this just to determine if there's any major problem. And then, yes, of course, if you feel that there's a problem, we send them in. And then we're going to inspect, and you're just going to look at both of these when you're inspecting the lids, the lashes, the brows, looking for any involuntary movements. We say that, but we're also going to look in the 6 directions for involuntary movements. So sometimes people would go, I'm looking for any involuntary movements, and I'm gonna have you just kind of watch my fingers, okay? This is the movements in 6 directions. Just keep your chin nice and straight and just watch my fingers. And this is my H thing, okay? Up, down, we're moving laterally, come across, good, up, down, and back to the center. And then I can even check for lid lag by going up and coming down to see if it is there. Okay, so that little H thing is kind of nice. You don't want to go super fast. It isn't a speed test by any means. It's a, and I watch her eyes to see when her eyes have completely moved as far laterally as they can go. I get to stop my H part here. But if you're only doing this and she's not moving into the lateral field, you got to make sure you get her all the way. So those eyes are moving completely, so that you can see they're responding and doing what they're supposed to do. Okay? And I would also note that I would look for any involuntary move. That's when we look too. When we get her way out into the lateral field here, I'm looking for that lateral nystagmus. So you can say it then, you can say it both times, I don't really care, but just make sure you say that. And then we're going to do direct and consensual response to light. And so we're going to, again, we'll have our pen light in hand, and we're going to just keep looking at me, and I shine the light across direct, and consensual I look at the other side, and then on this side direct, and then on consensual I look at the other side with the pen light. We're going to do convergence and conjugate gaze. Convergence, I'm going to ask you to watch my fingers, and just keep your chin nice and still, and just watch my fingers all the way to your nose. There we go, perfect. And you don't have to touch them on the nose, you can just get pretty darn close. We watch that both eyes symmetrically converge, and we also see that they should constrict as we get closer, okay? And then the conjugate gaze, I'm just going to have you gaze across the room, just gaze right over there, and then with my light, I have beautiful lights in this room, but you can do a quick pen light and just shine it on, and you should be able to see that symmetric reflection on both in the same spot, not one over on one part of the eye because it's moving away, so that she should have a very symmetric gaze. And then we're going to do our anterior chamber depth. Sorry, I don't have any of my equipment.
Excuse me, did you repeat that last part as far as with the pen light and the lighting being good in here? You have her gazing over
You know
here.
how eyes I look at, you guys, when you're practicing this, look at each other's eyes when you're looking at it. If there's nice lighting in here, we can see light reflection. It's pretty symmetric. As I just look in your eyes, I can see the beautiful light reflection. Probably it's a little more accurate when you're doing this to use a, you're so sweet, thank you, to use a pen light, and just look at my nose here, and we just shine the light, and we see that the reflection is in a symmetric spot on both
Okay.
pupils, or both,
Thank you.
both eyes. And then we are going to do the anterior chamber depth, and on anterior chamber depth, just go ahead and look straight forward, and this is where I'm going to shine my light in, and I'm going to shine it right on one side. This needs to come directly from the side so that you're shining it right through the anterior chamber as if you're heading for practically for the nose or the other side of the forehead. So we're just going to shine this in your eye, and I'm going to shine this in your eye. And I'm noting if there's any, if the anterior chamber depth appears normal. Okay, remember this is the one where as you shined it through the anterior chamber, if the chamber was very shallow, it would cast a shadow on the nasal side and on that particular eye. And then if we went to the other eye and that one was narrow, it would shine the shadow on that other side.
Is the shadow always on the iris?
It's not at all, no, I'm sorry, yes, because that's, yes, of course, because the anterior chamber covers that iris, yes. It's right on that, the iris is kind of behind it, but it's that chamber that is narrow and casting a shadow, but yes, you're looking in the area of the iris. It would happen if I did it this way, we'd cast a shadow, it's just hard to get in there because the nose is there. That's why we do it from the outside here, to cast a shadow on the opposite side, okay? And then, we're also going to look at the conjunctiva, the corneal clarity, and the iris for its condition. And I would like you to just kind of give the context. Just pull down a little bit and look at the conjunctiva and notice if it has any obvious. You'd be looking for erythema, but you're just stating that you're looking at the condition. And then the corneal reflex is just going to be you with that little piece of cotton, and you're just going to have the patient. I'd like you to look over there for a second. And this is how it looks. You touch it. I'm going to just touch and expect a blink response on that side. Look over there and touch and expect a blink response. Remember, you're not touching the sclera, you're getting on the cornea. It's the corneal reflex, okay? So you'd have to get over that iris. That's
So-
where you touch it.
In real exam, do we do that touching or just assuming you are doing that?
In the exam for our class, you're gonna do everything except touch, because we're gonna spare our patient models, okay?
So-
But in reality, with a real patient, you would touch and get the corneal reflex, yes. Okay?
We don't think we're doing even pretending we are doing the test just for the sake of the exam. For the sake of the exam, we just pretend we are doing even we don't touch it or.
Yeah, you just come near it, don't touch
or-
it.
So we're gonna have to have a cotton to do that?
Yeah, you're gonna have the cotton and everything in your hand, you're gonna have it as if you touched it, but you're gonna get about that far from it and not touch it. Some of us, we think about it and we have blink for you. We are very sensitive. And then, we're gonna go ahead and palpate and, could you close your eyes? I'm just gonna check the intraocular pressure, and you just palpate on both sides and see if it's similar. And then, I'm gonna use, I'm sorry, I don't have any of my stuff in here.
What do you have?
I'll just keep this scope
Here,
down.
what do they do if they have, if our patient has contact?
You can ask them to look down a little, and you can press, as long as their lids are closed, and press gently, I think we're okay. Those of you who wear contacts, would you agree? Pretty much, when we kind of look down, we keep them in there, okay? All right, fundoscopic exam. Again, if you're gonna use your regular, if you're using your regular one, the traditional one, you're gonna dim the lights, and you do need to dim the lights. And you're going to put the diopter on 0, and you're gonna turn your light on. You're gonna come at about, patient's gonna look across over there, you're gonna come at about a 45-degree angle. You're also trying to make your little circle the littlest that you can, the smallest diameter you can. That keeps her from constricting too much. And then you look right across. Again, lights would be dim. If you're in a private room, just open the door a notch. And I'm just gonna stand out here, and the first thing I'm gonna do is see a red reflex. And if I'm away from the patient, I spot that red reflex, and then I'm gonna keep this right next to my nose. I'm gonna come in close, hold, hold, hold. I'm gonna move my diopter once I see a vessel. I'm gonna move my diopter to try to get it in focus. Come in. And then from here, I'm gonna look up in all my quadrants. I'm looking at the vessels, I'm looking at the discs, I'm looking for any hemorrhages or exudates, and then would you look right into my light just for a second? Perfect. And I looked at the macula. Oh, beautiful fundus there, really nice. So you're gonna wanna get all those quadrants with these little guys, okay? You're not gonna see a very wide view of the back of the eye. So we wanna get up in the outer quadrants, inner quadrant, down low, and then you're looking for the optic disc, you're looking at the vessels, looking for any hemorrhages, exudates, and then right at the very end you say, look directly into my light. When she does that, the macula comes right into the light, and you're looking for the macula. And then when we go to the other side, for the test, you don't have to say all those things again. You're gonna say, and I'm gonna do the same thing for this eye. I'm gonna do it a little bit. And look right up. Good. One of the things, again, when you're holding this scope, you want to minimize the amount of movement, okay? So if you can hold it here and keep it pressed against your nose, the nasal bone, and right here against your eye, and now you kind of move as a unit. That eliminates some of it, rather than just being out here. And then once you spot the light reflex, then just drive straight in. You do not have to be, you can come out here, but then, see the light reflex if you want. Then, when you start out and when you get that light reflex again, you just drive in a little bit. You really don't have to. Part of us, we start way out here and we're trying to get in the back of that eye, and it's like we're taking a long distance highway there. So start close and come in.
Did you
Okay.
change your focus off of 0?
I kept my focus on 0 there, but I will tell you that and practice this, you guys, when I come in and spot a vessel, as soon as I spot that and get in position, I can take my focus and get it on the more positive and get it out a little bit so we can see the more anterior structures, and then focus it down to see the back of the eye. They do our fundoscopic exam then on the eye, and see the retina and everything. So you can play with that and work on that while you're practicing for now. Okay.
Before they actually look in the light, is there do you want them to look kind of at your ear, or
Yeah,
like
you want
at
to
an
kind of
angle,
look over my shoulder,
over the shoulder?
okay? And I come, so if we say look at the wall, kind of look over my shoulder, and then I'm going to kind of come in with these traditional ones at about a 45-degree angle. The panoptics are a whole different story, and does anybody have their pen? Thank you. Panoptic again, we're going to turn it on, we're going to focus. You don't have to focus on her, you can focus out here, focus a little bit on something in front of you, and now you're ready, okay? And now we're going to drive a little straighter in on these. At least that's what most of the students have been saying, that it helps. You can come in at an angle, but when you come in at an angle, you're kind of hitting the side of this and then coming around. So it's almost easier to just come straight in. So we're going to stand out here and we're going to look for our light reflex, or we're going to use a pen light and kind of, because we're not close enough with it, we're kind of going to use a pen light and see the red reflex, and then we're going to come in close here and look straight ahead, make contact, and now I'm looking at all the structures I just named, and you can just hold your position here, and then you come out, and then you don't have to switch hands or anything. You can just come right over here and do the same thing. See the red, and then come straight in, drive straight in, and I'm looking at all the same structures. Okay. You do kind of want to collapse this thing ideally. So when you're practicing these, I don't use these as much. I had it, her right eye, I wasn't so good on her left eye. I drove it in, and right away I could see everything. It was perfect circle. And then I collapsed. I didn't get it as collapsed because I was a little nervous about losing it. But do try to practice so you drive straight in, and then you darken that completely, and you'll be able to do it much better. Okay, so just drive it straight in. All right, that's that. And then you say all this stuff on one eye, and then you go to the next, and I think we're done. Okay. So let's really I would really try to